Hello. So I'm going to talk a little bit today about some 21st century policies that were implemented in the early 2000s that still are in place today and affect us today here in America. And so the policies are the Medicare Part D, the Affordable Care Act, and the Department of Homeland Security influence on the immigration policy changes that happened at the time. So, for Medicare Part D, why it happened in the early 2000s, prescription drug prices were out of control. A lot of seniors were on fixed incomes and they were skipping their meds or trying to ration their meds out because they just couldn't afford them. Medicare did not cover prescriptions at all, and there was a huge gap in care for seniors. So advocacy groups like the AARP pushed really hard, and with the baby boomer population, increasing, they added pressure to this Medicare Part D bill. And so Medicare Part D was created to help older adults and afford their medications. And what it did is it gave Medicare recipients a prescription drug benefit through private insurance plans. So it included things like premiums, deductibles, and cost sharing among Medicare holders. And low-income seniors got extra help with prescription drug prices or costs. So it made the medications more accessible to these individuals. So a lot of people some people were left with high cost of their medications. So with the Affordable Care Act, why it was needed. So before the Affordable Care Act, almost 50 million people in America had no insurance. People were denied coverage for pre-existing conditions, or they were just priced out to where they just couldn't afford procedures or, necessary treatments for chronic illnesses. And their medical debt was pushing individuals and families into bankruptcy. After the 2008 recession, millions lost employer insurance. So the ACA came from decades of debate about whether universal coverage should be put into effect, and so there was a big need to fix these inequities in healthcare in America. So what did it change? So it expanded Medicaid in many states. It created like an insurance marketplace to where there was, again, cost sharing and subsidies. Protected people with pre-existing conditions. So insurance companies couldn't deny you for, the marketplace insurance companies couldn't deny you for pre-existing conditions. It let young adults stay on parent plans until 2026. And it also reduced the racial gaps in healthcare access. It didn't completely remove this because we know this is still an issue today, but it did help, especially in cases that in states, that expanded Medicaid. And then, so the last one, the Department of Homeland Security, why was it created? So after 9/11, national security became the top priority. The government reorganized the Department of Defense into 22 agencies, and immigration was moved under the DHS, or the Department of Homeland Security, shifting it from like a humanitarian or a labor issue into a security issue. So what impact did the Department of Homeland Security formation, and how did that impact immigration? So immigration enforcement split up into 3 different departments, including ICE as one of those, and surveillance, detention, and deportation increased. So all of those things increased. Retaining of undocumented individuals in facilities, that detention that happened there, that all increased along with deportation. So programs like, secure communities, it connected local police with federal immigration enforcement. So local police were, communicating more with these federal immigration programs to deport undocumented individuals and enforce other parts of the policies. Immigrant communities experience more fear and family separation. Also, racial profiling was at its peak at that time. So why do these policies still matter today? Medicare Part D it connects drug pricing debates to pharmaceutical debates of the power that these pharmaceutical companies have in America today. The ACA, or the Affordable Care Act, is still at the center of conversations when it comes to things like reproductive health, Medicaid access, and universal coverage. Department of Homeland Security is still shaping immigration debates in America today, like border policies, asylum rights, and the treatment of immigrant families. These early 2000 policies still influence how we talk about healthcare, security, and social justice today.